Up to 80% of all women will have a fibroid by the time that they are in their 50s. It's a non-cancerous tumor in the muscle of the uterus. A small percentage of fibroids develop in the cervix, often causing problems with fertility. We learned more about an unusual technique to help one woman keep her baby dreams alive.
How big's Francesco?
Francesco Sancato is 17 months old and growing by the day. But getting to this point was a challenge for mom Mary Beth. For years, her periods were unpredictable and unusually heavy until one night.
I tried to, take a shower, and unfortunately, I had lost so much blood I became unconscious.
Mary Beth was rushed by ambulance to the hospital. Doctors found a fibroid in her cervix. Doctors suggested trying to shrink it with hormones or a total hysterectomy.
At the time, I was 36, and we had 3 kids, but we had in our mind that we would probably not be finished with our family yet.
John Demerit is an expert in vascular embolization, closing off blood vessels that feed tumors. In the past, uterine embolization hasn't worked on cervical fibroids, so Dr. Demerit and his team devised a new approach. They inserted a catheter in Mary Beth's leg, then worked to deliver tiny particles as close as possible to the fibroid.
We decided to try to thread an even smaller catheter than's normally used directly into the artery that feeds the cervix.
Doctors did a follow-up after 3 months.
Surprisingly, the fibroid had shrunk at that point by about 92%.
3 months after that.
He was a surprise. We were pregnant within 6 months of surgery. He is definitely our little miracle.
Francesco thinks so too.
And these methods will soon be available to the public in just a matter of years.